Today we're going to review the provider workflow for initiation and conduct of a telemedicine encounter through eClinicalWorks web-based version 11e. At this point, our patient has already been scheduled with a televisit appointment, which will appear on our office visits view that we see in front of us now. Several things to note about televisits and the way they differ from in-clinic visits as far as they appear on the office visit schedule. Number one, we'll see this blue video camera icon with the lowercase letter h in it. Just to the right of that, we'll also see a visit type that shows your practice's respective 3 or 4 letter initials followed by an abbreviated version of the word televisit. Another thing to note is a quick reference for the number of televisits that are scheduled for the day. These will show up in a TV jelly bean in the upper right corner of your view. This jelly bean only appears when televisits are on the schedule, and your televisits may actually be accessed by clicking on the jelly bean itself. For purposes of this training, we'll initiate the visit through a progress note. Just be aware that, again, the jelly bean can be used to access your televisits as well. To open our progress note, we'll click on the patient name or anywhere on the scheduled appointment line. We'll navigate to our progress note. It looks exactly the same as it does for an in-clinic visit. In the upper right corner, now that we've reached our progress note, you'll see this gray button that states patient is offline. That lets us know that the patient scheduled for a telemedicine appointment tied to this particular progress note has not joined the virtual waiting room from their side yet. Once our patients have joined the virtual waiting room and are pending the provider's initiation of the televisit from their side, that button will turn orange. There will be a green dot on the left-hand side and it will say Start Televisit Now. You'll also note that the televisit jelly bean has lit up red to indicate that we have a patient waiting for the televisit to be initiated. These two icons to the right of the Start Televisit button, this notepad and stethoscope, allow for provider review of vital signs and questionnaire information that may have been input by the patient prior to initiation of the visit. In this case, we don't have any information entered, but just be aware that that may be configured and it may be reviewed prior to initiation of the visit with your patient. When the provider is ready to start the visit and activate the audio and video feed with the patient, they'll click the Start Televisit button. And once that button has been selected, the first thing that pops up is this box in the upper left corner we see that will allow the EMR to utilize the microphone and camera attached to your machine. This will enable the audio and video feed to function so you can communicate with your patient in conduct of the visit. So we'll click Allow here. Every once in a while this error message may come up. For purposes of this training, we'll just close it out since our video feed is muted at this point anyway. This can have to do with connectivity issues on either the provider side or the patient side, dependent upon the internet provider and where this visit is physically being conducted from. In the live environment, you will see your patient's video feed here where this silhouette is, and your provider video feed will show up in this light gray box in the lower left corner of the video window. Several things to draw attention to in this window in terms of navigating the televisit itself. First, we have a visit timer at the very top of this window. This window may be manipulated and moved to several different locations within the eClinicalWorks window so that you can work on the progress note and access your right side chart panel if you need to get to it, which as you can see now is partially covered up. These 4 arrows facing outward in the upper right corner of the video window will allow us to take this to a full screen view. To shrink that back down and redock the window in the upper right corner, just use these inward facing arrows here in the upper right corner of the video window itself. This may be moved around your eClinicalWorks screen just by clicking and dragging. We also have the option to dock this in several other places using this button in the lower left corner here. So we can actually dock the televisit in the top row where our jelly beans are. You'll see that we still have our visit counter here. We have several other buttons we can use to manipulate our televisit. From this view, this first button actually pauses our video feed. So even though we can't see ourselves here, the patients are still receiving video feed from us. By pausing that video feed, the patient will no longer be able to see us. They will just see that silhouette that we were looking at just a few moments ago, but they will still receive audio input from you as the provider. This mute button will mute the audio input, but your video feed will still come through. And this red button we'll get to in a few minutes will end the televisit. To remove the televisit from beside your jelly beans, we'll just use this downward facing arrow. We can either pop it out back to where we initially saw the video feed appear, or this can be docked beside your sticky notes by selecting sticky note from the menu. You'll still see your video feed in this view. It will just be a little bit smaller, and you'll have a limited number of options you can select in that view. Coming back to the popped out version, there's just a few buttons I'd like to cover. If we select questionnaire here, this will pull any questionnaire information that was submitted by our patient prior to initiation of the televisit. This may be imported into the progress note using the import current page button below the questionnaire itself. This may be scrolled through and manipulated during conduct of the televisit in case any information was missed or needs to be modified based on patient original entry. Moving on to the next button, vital signs may be entered. This is an optional field for our patients on their side of the interface, so if no vitals appear, it's just because the patient did not elect to enter any. These may not be imported into the progress note directly, so if patients do enter vital information, that will still need to be manually added to the chart. This chat function allows us to send text messages to our patients, and they may actually respond to us that way. So if we have choppy audio feed at any point, or need to ask a sensitive question, and a patient may be in a public area where it would be preferential to send over text versus the audio feed, those are just two separate utilities for this chat functionality. As patients respond, we'll see the replies come back in this window, and this transcript will be available for the duration of the televisit. This is not automatically saved in the progress note or any clinical works following conduct of the televisit, so please be sure to include any applicable information from this chat window in the progress note itself if you would like it to be part of the patient record. The trackers button on the far right is a functionality that is not enabled, so we will not discuss that today. Moving to the bottom of our window, the pause button again pauses our video feed, and that will cause the patient to see this silhouette that we're showing in our upper left corner currently. We can make that video bigger again just by clicking on it. So if we pause our video feed, our patients will actually see this silhouette on their side, but again, they will be able to still hear us speaking to them. The mute function mutes audio, so the patients will no longer be able to hear us, but they can still see us unless the video feed has also been paused. During conduct of the visit, we may need to take a screenshot of an area of the patient's body, a wound, rash, incision site. In order to do so, we'll use these two camera icons here at the bottom of the screen. The first camera icon will take a snapshot of the full video window. We'll see that appear to the right of our video feed. And if we only need to take a portion of the video image that we're seeing from our patients, we can use this camera with the plus sign on it. That will allow us to actually drag and drop. You can see this box with the dashed lines expanding in my video window as I select the area I'd like to take a clipping of. Both those images appear to the right of our video feed. If we want to import these into the progress note itself, we just click on the individual image, or we can check this select all box, and then we use the upload button to actually bring those into our progress note. Once those images disappear, you'll know that they have been successfully imported, and if we scroll down in our progress note itself, those images will appear at the very bottom. We also have the ability, if we were using a device that had a forward-facing and rearward-facing camera, we can switch that camera feed. For most of us, if we're using an inbuilt webcam, that will not be a functional feature while we're conducting the televisit. This red button may be used to end the televisit, so once we've completed the conversation with the patient and we're done with our encounter, we will actually click this button to end the televisit itself. When we do that, we have two options. We can either end the call or we can check the patient out. So one thing to note is that when our patients enter the virtual waiting room, their status on the office visit schedule will automatically be updated to arrived. And when we select this check out option as opposed to end call, the patient status will automatically be updated to checked out on the office visit screen. So at this point, we will confirm checkout. Assuming that we've completed our encounter with our patient, you'll notice that the video feed ends, our TV jelly bean is no longer red, and our patient shows as offline. On the patient side of the interface, they will receive a message indicating that the televisit has concluded. Now, just a couple notes on billing. Number one, we have created a super bill with commonly used CPT codes applicable to telemedicine that may or may not be useful for your specialty. Many of the CPT codes and diagnosis codes included revolve around pulmonary and upper respiratory diagnoses, but I want to draw your attention to a couple items in that list. To access the super bill, we click the caret just to the right of the details button at the bottom of the progress note, and we select super bill from the next menu that appears. Your default super bill may not be set to Televisit at this point, but that's okay. You still have access to this now, so if you do not see Televisits appearing in this upper right drop-down box, you can just click the arrow at the far right in the corner and select Televisits from that menu. We start out with our Televisit common ICD codes. We can select an ICD code from this list. Sometimes the system glitches out in this version and it may not allow us to select an ICD that will then populate to the left-hand side of our window here. So if that is the case, just be sure to add the ICD code in the assessment section of the progress note prior to accessing this window. Once your ICD code has been selected, you can then navigate to the CPT code section. You'll see this is broken out into 5 different segments of applicable televisit CPT codes. The thing that is helpful in using this super bill versus manual entry of CPT codes is that the 95 modifier for telemedicine is inbuilt into the CPT codes captured in this televisit screen, so it will save you some time and remembrance of an extra step if you utilize this super bill as opposed to manual entry of CPT codes themselves. This first line item, TLVST codes, this is utilized for our self-pay patients. The current workflow is that we have a practice-specific link created that may be sent to our patients prior to conduct of a self-paid televisit to ensure that payment may be rendered prior to our conversation with the patient. There will be additional training offered in a separate video for that process, but just be aware for self-pay patients, we will use the TLVST code as a placeholder. Upon completion of adding all necessary ICD-10 and CPT codes to the progress note, we may then lock the note as we do for an in-clinic visit, and the charges will be translimited over to Imagine, automatically tied to place of service 02 for telemedicine. And with that, we've concluded our televisit encounter.